Reproductive Cancers, Cervical Cancer, a presentation by Kathleen Ministerio for Human Sexuality 425 with Professor Tony Espinoza Farrell at California State University, Long Beach. What is cervical cancer? Cervical cancer is one of the most common female reproductive cancers. It begins in the lining of the cervix at the lower uterus or womb. The cervix is composed of two parts, the endocervix and exocervix. The endocervix is the part closest to the body of the uterus, made of glandular cells. The exocervix is the part closest to the vagina, made of squamous cells. Both parts meet at a place called the transformation zone, where cervical cancer begins to develop. At this zone, the normal cells of the cervix may gradually develop into precancerous changes that turn into cancer. It is important to note that only some women with precancerous cells of the cervix will develop cancer. However, early detection and treatment are key in preventing the formation to cancerous cells. Cervical cancer and precancer is usually classified by type. 9 out of 10 cervical cancers are classified as squamous cell carcinoma. This is the most common, of which the exocervix develops squamous cell carcinomas. The second common cervical cancer are adenocarcinomas, which develops from gland cells of the endocervix. This type has seen an increase in the past 20 to 30 years. The least common is the adenosquamous or mixed carcinomas, which is a mix of the two. Other cancers that can occur are melanomas, sarcomas, and lymphomas, though they are more common in other parts of the body. Risk factors that increase chance of cervical cancer are HPV infection, smoking, long-term use of oral contraceptives such as birth control pills, a weakened immune system, chlamydia infection, a diet low in fruits and vegetables, being overweight, intrauterine device or IUD use, having multiple full-term pregnancies, and being younger than 17 at your first full-term pregnancy, economic status, diethylstilbestrol or DES use, and having family history of cervical cancer. It is important to note that modifiable risk factors are those that you can control, change, or avoid in order to decrease your chances. Modifiable risk factors include smoking, HPV infection, and use of oral contraceptives. HPV is the most important risk factor because it is a group of more than 150 related viruses, some of which can cause a growth called papillomas or warts. This can infect cells on the surface of the skin and can spread from skin to skin contact. It is believed that those that are HPV infected are strongly linked to developing cervical cancer. With smoking, carcinogenic chemicals in the cigarette or smoke can affect organs other than the lungs. Women who smoke are twice as likely to develop cervical cancer. Prolonged use of oral contraceptives or birth control pills increases the chances of the cervix developing cancer, but the risk goes back down after the oral contraceptive use has stopped. Other risk factors are weakened immune systems caused by HIV, chlamydia, which is a bacterial infection that can infect the reproductive system, leading to infertility and cancers. Poor diet and being overweight increases the chances of developing adenocarcinoma. IUDs actually lowers the risk of some reproductive cancers such as uterine cancer and cervical cancer, which could be a great alternative to the risks present from birth control pills. Amount of full-term pregnancies increases the risk of developing cervical cancer, and those that give birth younger than 17 are twice as likely to be at risk. Lower-income women are at greater risk due to the lack of access to healthcare services that can help screen for HPV and other cancers. Diethylstilbestrol is a hormonal drug that women take to prevent miscarriage. It has been reported that mothers that have taken DES developed clear cell adenocarcinomas, with 1 out of 1,000 women developing cancer. Having family history also increases the risk by twice or 3 times as much compared to women without previous history. Symptoms of cervical cancer include abnormal vaginal bleeding, unusual vaginal discharge, pain during intercourse, pelvic pain, discomfort while urinating, heavier and longer menstrual periods, loss of bladder control, unexplained weight loss, constant fatigue, and leg pain. The most common symptoms to look out for are the top three, being abnormal vaginal bleeding, unusual vaginal discharge, and pain during sex. These signs and symptoms should be paid close attention to, and if you experience any of these symptoms, see a healthcare provider right away. Ignoring symptoms may allow cancer to grow to a more invasive and advanced stage, lowering the chance for effective treatment. Early detection and prevention. Early detection is key in lowering mortality rates. If detected early, cervical cancer is one of the most successfully treatable cancers. According to the American Cancer Society, women should follow these guidelines to help detect cancer. All women should begin cervical cancer screening at age 21. This includes pap smears and HPV tests. This screening procedure can find changes in the cervix before cancer develops. It can also find cervical cancer early in its most curable stage. Cervical cancer death rate has gone down by more than 50%. The main reason for this change was the increased use of the pap smear test. Prior to this, cervical cancer was once one of the most common causes of cancer deaths for American women. Women that are at higher risk, such as those with weakened immune system or have been exposed to DES, may need to be screened more often. Pre-cancer and cancer prevention also stresses to avoid contact with HPV. Since HPV is the main cause of cervical cancer, avoiding exposure prevents the disease. It spreads easily through skin-to-skin contact. Therefore, those that engage in sexual activity should get vaccinated in order to protect against infection. To increase protection, using condoms lowers chances of HPV infection by 70%. Smoking is another important way to reduce risk of cervical cancer. Treatment. The options for treating each patient with cervical cancer depend on the stage of disease. The stage of cervical cancer describes its size, depth of invasion, and how far it has spread. After establishing the stage of cervical cancer, your healthcare provider can recommend treatment options, which can include surgery, radiation therapy, chemotherapy, and targeted therapy. For the earlier stages of cervical cancer, either surgery or radiation combined with chemo may be used. For later stages, radiation combined with chemo is usually the main treatment. Chemo by itself is often used to treat advanced cervical cancer. Other treatments can include clinical trials, which are controlled research studies that look into promising new treatment or procedures. Considering complementary and alternative methods can also treat or relieve symptoms. This can include use of vitamins, herbs, special diets, or other methods such as acupuncture or massage. Incidence and prevalence among different cultural and ethnic groups. According to Cancer.org, in 2017, 12,820 cases of invasive cervical cancer will be reported. Of this, 4,210 women will die from cervical cancer. As a result of increased screenings such as pap smears, there has been a decline in cervical cancer rates. Difference in ethnic groups show that declining rates have been stable for white women younger than 50, while a more prominent decrease has been seen in minorities. There has been a 3% decline amongst Black women younger than 50 years old. For women older than 50, there was a 2% decrease in white women and 4% decline in Black women. Survival rate discrepancies show that white women are 69% more likely than Black women to survive. According to the CDC, the graph above shows cervical cancer rates by race and ethnicity in the United States. In 2014, Hispanic women had the highest rate of getting cervical cancer, followed by Black, white, Asian or Pacific Islander women, and American Indian or Alaska Native women. This concludes my presentation on cervical cancer. I hope you all learned something new and thank you for watching.